Hello and welcome back to the I Rehab Podcast. My name's Nick Kane. This is an installment from our clinical cases stream side of the podcast where we try and delve into, real world examples of when a clinician has managed an injury, whether that's an interesting case, something with certain time pressures, trying to gain insights into both the process but also the decision making, the collaboration, the conversations that are had with the medical high performance team and the athlete. So today we've got Byron Field, the head of the Wallabies outfit at Australian Rugby. He's a physio by trade and has previously worked at the Brumbies in the NRL, and he talks to his experiences within that. Byron has presented for us on the Masterclass on AC joint injuries, and he'll do one later in the year on neck strength, and it's relevance to concussion on the back of his PhD work. Really interesting case today, talking through a re-injury, so to speak, of an Achilles rupture. Give some great insights into that process of working with a really high-level athlete and getting him back to performance with a couple of hurdles along the way. So I really appreciate everyone jumping on and tuning in, and hope you enjoy this clinical cases chat. All right, mate, welcome to the I Rehab Podcast. This is the second edition of our clinical cases stream of the podcast, and today we've got a really interesting case you're going to talk us through. But before we do that, why don't you just fill us in a little bit about yourself and what you're doing now and your background?
Yeah, mate, thanks. It's great to be on, and it was cool. A cool topic you put to me. There was a couple of cases that came to mind initially, so it was great to be able to talk through one of those. My background, I'd have been a physio, for a good while now, and I kind of fell into professional sport pretty early on. I didn't spend a bunch of time in clinics, but that was kind of where I cut my teeth on cold sidelines, running up and down and covering club football and in rugby in particular. So I kind of live up in Canberra. I worked at the Brumbies for several years, and then got an opportunity to go over to the UK and kind of lead up the Bath medical team over there, which was a lot of fun and something I'd recommend to all the physios out there listening. Just a great way to see a different part of the world and learn a different way of doing things. So that was a kind of a seminal moment in my career heading over there. And then I came back to Australia just after COVID finished, and always had a passion and respect for the Australian Defence Force. I worked for 12 months with those guys and learned a lot about leadership and doing things different ways. So I kind of took a little break from professional sport, which I really valued at the time. And then just recently I've jumped back in. I came back to the Brumbies as a head of performance health for a couple of years and worked with a great team of strength and conditioning coaches and coaches up there in my hometown up in Canberra. And then just recently in last year took on the Wallabies role, which is a lot of fun at the moment. Again, blessed to be working with some really intelligent and savvy people in the professional sports business. So, mate, that's keeping me busy at the moment.
Yeah, mate, it's a really impressive career to date. You've also recently completed a PhD in around neck strength with an interesting concussion. Can you tell us a little bit about that?
Yep. Labour of love. So I started my concussion PhD when I was over in Bath. I was having lots of conversations in my role with athletes that needed to retire with ongoing symptoms from concussion, and it was a bit of a want to do more for those players. And since then, it's evolved a little bit. And right at the moment, we're in the middle of a paper looking at women's rugby, probably underrepresented in the research. So trying to invest a little bit more time and resource into understanding whether those players are at a higher risk compared to the male population. And neck strength in particular, Nick, is something that I find really fascinating, and I think will evolve in our careers in sport to be significant in terms of our abilities as a primary prevention tool to offer players a little bit more ability to slow down those inertial forces if we can actually get the framework and the architecture right between head and trunk. So a big passion in that space.
Yeah, really interesting stuff, mate, and really looking forward to film a masterclass with you later this year around neck strength and its influence on concussion. So we'll be able to bring lots of that information together for a really great resource for our listeners and members out there at SportsMap. Obviously, you also did a masterclass for us earlier this year on AC joint injuries. So you clearly got a lot of great knowledge, because that was a quality masterclass to view for anyone working in contact-based sports. But today we're here to chat around our clinical case, and you've got a really interesting case around the Achilles rupture. So can you give us a bit of an overview of what that case was, and then we'll try to delve into things a little bit further from there.
Yeah, it's reasonably complex, Nick, in terms of how it all kind of unfolded. So I was in Australia in 2018, waiting to head over, and a great team over in Bath there that were looking after this particular player, international, hell of a talent. He'd had an Achilles rupture during the Six Nations, I think, of 2018. So it was about 3 months post injury. If I've got my timings right there, and then was out and about, stepped back and re-injured the Achilles, so re-ruptured through. I was still in Australia at that point. I got the phone call around my thoughts, what we do from there. There's obviously a reasonable amount of panic in the player at the time. No one had really seen one. We did a lot of research in the NBA, and I talked to people in Australia that I knew, kind of sitting on the ground waiting to head over. I talked to guys like Craig Purdom, I've got a lot of respect for in that space, and no one had really seen a re-injury. Probably the trickiest Achilles might be a bilateral, someone that's kind of had one and injured the other side, and even they're very rare. So we couldn't find, there's no case studies, there's no N of one out there for this type of injury. So things we were faced with are around changes in the anatomy and the architecture of the Achilles, how long we needed to protect it for. There was probably no one was really sure whether this player had a second chance, whether we could actually get him back, and certainly not a third chance. So we had to be really protective around the repair. I kind of got over there, and he'd probably been about a month post the second repair. Was kind of when I landed on the ground there, and I had 3 brilliant physios over there who were working with the player at the time, who did great work. Those early foundational pieces, and my role was to kind of come into work with the athlete a little bit further down the track. So that was kind of the scenario that we're faced with. Really, really interesting injury that no one really seen, with no playbook.
Okay, so we're 3 months post an Achilles repair, and we've re-injured, so that'd be pretty devastating for the athlete, I'm sure. As a team and collective, what were some of the conversations that were had around the first initial 3 months of management? Were there any learnings to take from that? Anything you thought you may have missed or would do a little bit differently? And what was the general team's thoughts on this?
Yeah, definitely. So the first thing with any re-injury is a pretty deep dive, and it's something that I've gotten a lot better at, is the humility and the ego hit when you do have an injury, is to look deep into why that happened, and it's a personality thing, right? Some of us do it better than others at self-reflection, but it's certainly something that we spent a lot of time on in that particular case, and it's it was the graft hadn't taken, so he kind of had a stub between both ends of the repair, and maybe some sort of sense of inevitability. There's a lot of blame. The athlete blamed himself, I think, early on, but pretty quickly we realised that it was probably just a non-patent repair, and the second repair was nice and strong from the word go. Used an open technique. I think it was a Krakow procedure, so really tightly woven. And the questions in that space that we had to answer early on, and we didn't know. They were all theoretical questions. Was how much shortening did we have, and is shortening an Achilles repair by 1 centimetre to 2 centimetres, so taking away length? What effect does that have on someone that really needs high tensile strength and the ability to use their kinetic energy and run it around 10 metres per second? How did all those factors influence it? And then the human factors as well. They'd already done 3 to 4 months worth of rehab, and they were kind of starting from scratch, and it had to be even slower the second time around. So lots of human elements in there on top of things like what was the impact going to be on cross-sectional area of the calf, soleal complex? How is that going to affect his rate of force development? And then how long should we spend? That's a big thing in sport, is what's our timing around trying to turn this around? And there's complexity in all those questions as well. This was complicated by the fact that I think we were about 8 months away from the end of our season, and then about 10 to 11 months away from the Rugby World Cup in 2019. So it had horns on it from the start, but it turned out to be a pretty interesting way to proceed with it. That's for sure.
Okay, so you've sort of mentioned there how the Achilles tendon maybe didn't get a true knit or a good heal through that initial period. When it comes to the surgical intervention, again, was there a different conversation had with the surgeon? Was there a second opinion needed? Do you think the technique that was done initially was satisfactory? What were some of your findings and thoughts here?
Yeah, those decisions kind of preceded my time there. I was still in Australia trying to do as much research for them as I possibly could. So, it was an exercise in leaving it in the very capable hands of the medical team on the ground over there. And we had one of the best surgeons in England who I went to find out had done some amazing work, and we had a great confidence in the ability of that particular specialist and surgeon. He was fantastic the whole way through, and I continued to use and have a good relationship after I got over there. But that, in different cases, not in this particular case, but in different cases, certainly seeking second opinion around different things, I think is a fine way to do it, as long as it's done the right way. Informing people the whole way through, and I think it's a very we're not obliged, but I think in terms of really shaking the tree and giving players, athletes, people, patients as much advice as possible. I think when you do get a re-injury, I think it's a very reasonable thing to do to dive into different opinion and be very open about the fact that you're doing that. It's not going behind backs. It's being transparent and being thorough. I think, Nick, would be my thinking around that.
Now, you touched on the challenges there associated for the athlete in such a big time out again from an injury. What were some of the strategies you were able to put in place for this athlete from a mental standpoint, or some goal setting and the like, in how to get the best out of him and for him to feel ready to go again with the rehab process?
Yeah, so it's I think one of the things that I learned from this case, and that's why I thought it was a nice case to talk through, is I think we learned as much about ourselves as we did about the player through that particular time. A lot of players at the top end. This guy went on to play 50 or 60 tests, 5 British and Irish Lions tests. So he's a hell of a player. So the thing that makes him very good is his motivation and internal drive. And that's under stress when things aren't going well in the early stages, when we had to be patient and respect healing times, and no more chances after this one. So we had to go reasonably slow in that early post-op period, second time around. So it was an exercise in patience, and listening to him talk down the track, it's like that was his big torment. It was that non-linearity around the rehab, the complexity of it doesn't just get better. Input doesn't equal output. We'll do a strength block on one particular day, and that doesn't particularly mean that he'll feel the same the next day. So there was different ups and downs in and around it. So his ability to cope with that was stretched and tested. And probably we got a little bit outcome focused. We were looking at this big goal down the track, and we kind of had to really dial it back in and do some periodized training to really focus short term, small processes, small steps along the way. He'd been out for a long time already, and he was impatient to get back. But that was a strength, and under stress when things weren't going great, that would become a stressor. And we kind of all learnt that about each other, how to push, how to pull in different moments, have the big goal there, certainly in the distance, that kept our North Star nice and aligned, but also bring it right back down to the mini processes within, mesocycles, microcycles, break it right back down to simple little things that were visual, tangible, right in front of us to kind of keep us dialed in and focused. But support network and understanding stakeholder need in that one was critical, Nick.
Yeah, it's always really interesting to hear about working with the athletes, so more than just the injury. So some really nice insights there. Now, mate, to talk to a little bit around some of that early loading and protection strategies that you would implement early on, can you take us through that? And it'll be interesting to, I guess, compare that. We have a masterclass coming later this year with Peter Maliaris on Achilles tendon rupture rehabilitation that sort of works through these steps. So, but yours may be a little bit different given it's a re-injury and it's a different type of athlete at high level rugby. So I'd love to hear about some of those strategies that you used early on.
Yeah, I think so my role, I had a wonderful physio, Joey Hayes, picked up the early components of it. That was just our structure, and he did great work in setting the foundations. But the foundations were antalgic gait, it's really struggling to get heel off ground, really, really typical things in those early stages, and struggling to get a muscle adaptation response. But we persisted, and damn, the hard work that went into that, the frustration, I kind of remember it really clearly, to the point where I kind of picked him up towards the mid to late stages, and we'd probably plateaued a little bit just in terms of marginal gains. So it was kind of a nice opportunity to shake things and try not a slightly different approach. I think Ant had been by the time I picked things up was probably around 200 to 300 days in rehab. So just freshening things. And around the same time, Nick, I kind of got into complex systems thinking, which kind of shook the whole piece up for me. And it made it quite clear as to how we challenged the environments. So putting the player in different types of surfaces, different shoes, different times of day, different locations. So really throwing the playbook out there a little bit and just shaking things up, so freshening things for that, to try and break the monotony that kind of comes with those long-term rehabs. Change the task, so different types of supination and pronation involved with our heel raise, playing around with the periodization, so giving him bite-sized chunks, so breaking down those microcycles into a step loading block, a wave loading block, so building things up or building things in and out, so playing around with the adaptation, and then the person as well, so really dialing into what that particular player needed at that particular time. And that was some difference. We tried going to different locations. We went up to London from I was in Bath. We went up to London, used different facilities, gave him different types of feedback. So one of our objective markers was using 3D kinematic analysis, so showing him different things. And then most importantly is getting him ball in hand. And I think perhaps as in our rehab, I think we can, ball in hand is my sport, but really showing a player or an athlete where they're headed. So getting a coach involved, hearing a different voice, making it as game simulated as you possibly can, even in those early stages. So they start to visualize and use. We hear the Wallabies talk a lot about the mind gym and that ability to visualize what you're going to be doing in the future and setting up neural pathways and starting to play around with his ability to get back. So the other piece about probably complex systems thinking that I kind of intertwined was just around a tipping point. I knew there was going to be a point in that rehab somewhere, sometime, where we'd both know that he could come back. And to that point, we didn't. And there was still lots of questions around, will he play again? And will he play in that season? And if so, when will it be? And the tipping point for me, Nick, was probably around, we'd been through three blocks of training. So built into a month block each, and our end goal at each month might have been, have a weekend away with his family, or it might have been we had a milestone around his strength or rate of force development marker that we'd put in place. And then at the end of the third month, so getting kind of close to back end now, our goal was a VMAX exposure, and I think we might have bought running spikes, but I put him on a tartan track, down breeze, headwind behind him, and we kind of got up to around 9.6, 9.7 metres per second. And I've still got the video of it from several years ago, and it was a big moment. I was like, okay, if he can produce that kind of horizontal velocity, we're going to get back. It's just a matter of time now around recreating that exposure, getting his game-based metrics up. But I was like, if he can do that, then he's a good enough athlete, and he's returned to that's quick enough at the international level to be able to come back. So that was kind of our tipping point. At that point there, I was like, no, he's going to get back now.
Now, if you're not up to speed with the Masterclass platform and what's been coming and what's coming out, we've had the likes of Brian Heiderschott on hamstrings, recently Byron Field on AC joint injuries. April is a double Masterclass month with UFC physio in Tim Roberts and Adam Castrigan talking to bone stress injuries. Plenty more coming in the coming months. And event-wise, don't miss out on the hamstring event in Northern Italy, late June. And we're off to India for the I Rehab Sports Injury Conference, going to Bangalore, August 23rd. So a couple of really top events you don't want to miss if you're from those regions. Hope to see you there and connect in person. But let's jump back into this chat with Byron. It's really interesting to hear about how you have periodized the rehabilitation, the different stages and cycles within the process there. You touched on a little bit around strength and rate of force development. Can you talk us through a little bit about your benchmarks there and what sort of testing was involved and exercises to, I guess, achieve some of those benchmarks?
Yeah. It'll be interesting to see where you get to with Peter, because having worked with a few Achilles before and since ruptures, you kind of feels like you get this little plateau around 80 to 85%. And then you get these marginal gains after that in terms of strength profiling. And we're just using basic isometric force plate measurements, seated and standing. So we got to about 80%, and his power output equivalently, so his rate of force development on a drop or counter movement jump, was actually starting to reach more like 90 to 95%. So he was able to produce force, but obviously had a big cross-sectional area deficit, and people that have worked with Achilles ruptures, you'll know that near impossible to get back to anywhere near the bulk that you had before. So, there's different types of technology that we're using now to map through volumetric analysis, so tracing around things and seeing where you get to. So the volume's down, cross-sectional area is smaller, strength is certainly smaller, even though you're doing what you think is a textbook overload using principles of training. So really breaking that back down, making sure you're leaving enough time for adaptation between exposures, working with your time under tension. So all your basic principles seem right. They're a little bit hard to create muscle soreness. So if I had my time again, I probably would have tried to use a little bit more isokinetic dynamometry for training as opposed to just testing. So really dialing in on the ability of isokinetic dynamometers to put that muscle under the stress through the right ranges. So the inner and outer range of plantar flexion would be something that I'd do if I had my time again with that one. Yes, so we were saying there that your rate of force development starts to look pretty good, and we knew that because he was producing good horizontal force. So his acceleration mechanics, and using my coach's eye and some video-based 3D stuff as well, we knew that he was producing pretty good force. It was just trying to work out the consequence of having such a big strength deficit in all of that, and that was kind of where we got to in the end. It was like, which data point do you use? And if one data point is particularly off, is that compensated for somewhere else? And that the complex system in that particular case, his body had found a way. So he was using his synergist, his contralateral hip flexors, his huge ability through the rest of his posterior chain to produce force, his intrinsics within his foot to compensate for what he was missing in strength. So had we waited for that strength to come from 80 to 90%, I don't think we would have got that goal. I don't think we would have got there. It'd probably take another several months to actually build that up. And the consequence of that, Nick, is actually really interesting. And that's something we probably didn't consider as much at the time. But what was the ability of the body to compensate? And then what was the cost of that? And the cost of that is overload elsewhere. And that's what you often find with these big joint compromise athletes, is that you can get them back in a reasonably quick time, particularly if that athlete's motivated. In this case, it was extreme motivation to get back. But there is potentially a cost to contralateral calf, hamstring, quad, et cetera, et cetera.
Okay, so I guess you're saying in this instance, they might have not achieved, over that 10% asymmetry strength index that you might want, but you're finding their performance markers there. They're sort of back to baseline and able to execute what you need to do. Maybe taking on a small element of risk of overloading another tissue or region of the body. Did you come unstuck at all throughout the rehab process? As maybe integrating into training or something along those lines?
Yep. So it was a pretty wonderful story. We returned him. So as I said, we hit our tipping point, and from then it was a matter of building exposure. That we went to some dark places, which kind of reflecting on now was good fun, because I knew what it was going to take to get him back to return to play. We had to shake the tree to make sure the decision was right, that he was to come back to play, because there was a significant amount of stakeholders, club, country, club owner, everyone at the time was kind of interested and having input as to whether he should or shouldn't. And you take all that away, we're advocates for the player and the athlete or the patient. I was very attuned to his goals and what he wanted to do and his motivation, and we spent a lot of time together trying to achieve that. To the point where I was probably a little bit blindsided, like a player that was incredibly motivated to get back. I was incredibly motivated to get him back. I probably didn't sit in the empty chair and ask the questions around data. It was probably too subjectively driven. We were going, and I've learned a lot about myself in that, Nick. It's like sometimes when I get a player or a person that's really driven, hard, motivated, because that's kind of my natural instinct as well, I kind of do need someone to step in from outside and give me a little bit more of a prudent approach to that. So I'm very big on personality profiling, knowing the profile of your athlete and what they're like. Anyway, that's just an aside. But in this case, we returned to train. Big, everyone's around clapping. Fantastic effort to get there, beat the odds. First session back and bang, contralateral rec fem goes. And I was like, and that was, in hindsight, it was probably a blessing in disguise. It gave us a little bit more time to fix up a couple of things. I just hadn't done the kicking load. So his running load looked great, but we hadn't, dived into kicking exposure, which probably caused our problem in that case. Very, very common for your AFL listeners, but probably had just underdone one part in our rush to try and get back to return. But that, a blessing in disguise. It took around 4 weeks to come back from that, and then eventually returned to play. And the biggest thing was that we had to return to play in the Premiership, to play some games to be available for selection for the Rugby World Cup, which ended up coming through and ended up playing in a World Cup final, which was from where he was 9 months earlier was an incredible effort on his part. So very privileged to be a part of his journey.
Yeah, that's such great insights into, I guess, the process in some sport in the real world. And I know I can think of a couple of instances in my career where, an athlete can be so good and so confident and so convincing that, maybe that causes you to be a little bit less reliant on the data or other aspects because, they're so gung-ho about it. When you did his quad and after that, how did you feel about that on reflection? Was there anything that you wanted to, you thought you might do slightly differently, or it was just one of those instances that, that just happens and it's part of the process for these long-term injuries sometimes?
Yeah. I mean, I knew what had happened straight away. We kind of got to the back end and probably rushed those end stage return to train metrics. So I probably wasn't as dialed in. I was probably so focused on the Achilles that I probably forgot his whole system, and the ability to detrain over 300 to 400 days worth of not doing normal things, so it'd be a lesson in really shaping what someone needs to return. What's their core role? So is it a fullback who's got to be able to leap X amount of times in a training session and multiply that over a week. So you start to get this overall holistic profile as opposed to just the running based metrics, which are right in front of us. It's dialed in, lots of stats, lots of numbers on it. We can see it, but it's those game based things. And my interest now has kind of turned to how that affects contact injuries, shoulders, necks, concussion. Are we exposing people to the right amount of physical qualities in a contact sense? After a concussion, do we hit a couple of bags and call that, yep, ticked off? Does that actually reflect the nature of contact and the magnitude and the velocity of forces that are going through the neck, shoulders, brain? So I would have used those learnings, I guess, from that particular case to extrapolate out a little bit more to the holistic nature of how you need to return someone.
Okay, so mate, bringing it together, where are we now? How far are we past that the surgery date as we're nearing that return to play period? And where did we end up, I guess, with some of those testings? Did we end up getting past 90% strength index on a few of those tests, or you still ended up having a bit of that compensatory strategy even after the recent quad strain?
Yeah. So how long till we got back? I think it was about 430 days, and I made a video. So I captured a lot of video on the way back through, and we sent the video through on the return to play, which was probably risky because we'd had a bit of a celebration on return to train, which backfired. But anyway, alas, I got lots of people to send their feelings because everyone had been watching this guy absolutely batter himself on the side of the pitch, and you would all your listeners would relate to that, right? You've got the person that's flying up and down, and everyone can see them doing their work, and he worked harder than the guys training, and that was kind of one of our things is we're going to outwork everyone out there. Return to play successfully, and that particular bite of return to play was fantastic. So went on to earn selection, and that's a pretty hard thing to do, only being given a couple of games to do it into a national World Cup squad, and then went on to the final, and then thankfully has had a successful career since. Not without setback. Certainly we did encounter some frustrations around secondary injury, and I think that, as we said, Nick, that 80 to 85, I think we probably plateaued somewhere around 85 to 90% for the rest of his career. But that certainly, you've got to get that force from somewhere, right? So if you're leaking 13 to 15% from one side, that has to be made up from somewhere, and oftentimes that'll be an overload of a contralateral calf or somewhere in that system. And that's the great learning for me from that process was the complex systems theory. The body will find a way, but often there's a cost to that.
Now, often people like yourself and the rehab professionals out there, they're sort of in the job because they get real enjoyment and satisfaction from working really hard at something like this with an athlete and getting a really good result when they do return. Fill us in on a little bit of your feelings or emotions when you finally see him run out and perform on the big stage.
Yeah, you'd have had those cases as well, Nick. You're holding your breath for those first couple of games. Like that's like, oh, we've done the right thing here, because there was a lot of there was questions on return to play, whether it was appropriate from lots of different people. But I'd known by the time we had the rec film, I'd known he'd done his work. He was ready to go, overripe probably. So it's like, we can keep training here, and get ready for next season, or we can back ourselves and return to play. And it was a brave decision from the people involved, the coach at the time, to trust me and to trust the player that he was ready to go by that time, and he certainly was. So yeah, that was. I mean, they were great learnings, but just the team effort that went into it. The medical staff at Bath, I was relieved for them. They were involved from the very first injury, not even the re-injury, but they'd been a huge part of it, and I kind of flew in on the very back end and kind of helped a little bit around the return to play side of things. But the amount of work that they'd done, I was really happy for them, and he was, more grateful than any other player I've ever known to those staff. Those strength and conditioning and physios that had worked with him, and just an incredible case to be a part of, with probably the intersection of the most driven athlete I've seen with the most complex injury I've seen, Nick.
Yeah, nice, man. That's really cool. One more question for you, and I probably should have asked this earlier in the podcast, but a little bit around, you mentioned that first injury didn't quite get the knit of the Achilles and re-injured at 3 months. In the second go of the rehabilitation, was there anything put in place around, monitoring that healing process from an imaging standpoint, ultrasound, MR, etc., to, guide readiness to return with certain progressions? Or you're still able to just, guide as you would based on clinical presentation?
Yep. You can't. We did talk about it. I remember having a chat with our club doctor at the time around the value of re-imaging. Like what are we going to find there? In terms of the union, a very thickened tendon. So it's atypical. So it's not going to have normal appearance. It's going to have disorganized collagen fibers still. It's not going to. There's no baseline to compare it to. There's no ultrasonographer or radiologist who's going to be able to tell you whether it's good or not. So in terms of external expertise, we certainly did that in the early stages, but the most important people to me were the people that had spent a lot of time around the player. We do go looking for external opinion a lot, and I think it's really important to canvass that. But to me, the most important people are the people that intimately know the program, the context, what they're going back to, and the athlete. And a lot of the time, that's the person next to us. They're the person that can see something that I can't see, as opposed to going and seeing, some of the great specialists that we've got around the place, Nick. So it's a bit of a learning through my career. It's like sometimes the most important person to ask is the person around you, and maybe they're not giving opinion because they haven't been asked for it. But uncasing and unlocking some of the opinion that's sitting right next to you, I think, is critical. Whether that be an analyst, a coach, I rely a lot on our data analyst up here, a guy called Matt Watkins, to tell me whether he thinks a player's behaving normally. I've returned them to plays. Like, are they hitting their line there? Are they doing what they need to do with an eye that I can't see? They're the most important things to me, and oftentimes they're right under your nose. Those opinions, you just got to go and seek them out.
All right, mate. Is there anything we've sort of missed throughout this chat and conversation? Any of the key learnings or things you wanted to pass on to our listeners that you thought were really important that we haven't covered yet?
No, mate. I think that's probably it. I mean, these are all we're several years post this particular case now. So for me, it was the learnings that you take from those long-term rehabs. That'd be, for the listeners, it's like, reflect hard, use the people around you. And then this kind of introduced me to a complex systems way of thinking. It's like when you get these really tricky bits, it's like step back from it and give yourself a learning opportunity. Things are non-linear, adaptations very unique to the person. And then, how can you challenge things slightly differently, put a different lens on it, while also, keeping the most important thing, which in this case was his strength profile.
All right, quick little pivot, but you've mentioned complex systems theories a couple of times. What is that? And I know Natalia Bittencourt has done a bit around the hamstring piece, But where could we sort of access some new readings or something, a resource around complex systems? And I guess that's maybe for another podcast. But yeah, any resources you can guide us to?
People like Sam Robertson, David Joyce, really good big thinkers around context and how to do things. So they would be people that I would kind of look to and read a lot of their work in around concept mapping, understanding the complexity of how different things can occur and how different opinions can influence things. What is it within that system? It's the person, the task, the environment. Sometimes it's outside, it's well outside that can be the thing that's causing the problem. It can be, it wasn't in this case, but it can be yellow flags and things, stressors that are a little bit below the surface that are affecting someone's ability or motivation to do your particular program that you've given to them. It might not be your program. So certainly outside the box thinking, I think, is critical, Nick.
Well, mate, thanks very much for joining us. It's been fantastic to have a chat through this case. Really appreciate your insights and honesty within it. Some great learnings there for our listeners. Look forward to working with you on the next masterclass around the neck strength. And, mate, all the best with everything that's upcoming with the Wallabies.
It's been a pleasure. Really nice to chat, Nick.